Dear colleagues, welcome to this recorded introductory lecture about the clinical learning chain in the extended modular program, how to adopt the adult learning principles. You are expected to watch this lecture before attending day one of the basic training. We are university professors, which is definitely much more than a clinical consultant. One of our responsibilities is to achieve the goal of undergraduate medical education. On graduation, students should be able to use the knowledge, skills, and attitudes gained together to perform the tasks assigned to a primary healthcare provider safely and efficiently. We are dealing with adult students, and adults learn different than children. Adults build on previous experiences. Adults need to know why are they learning. They are always asking, how am I going to use it in the future? Adults prefer to be self-directed, as long as they are well informed about the learning outcomes needed. They need to know exactly what are they responsible for, what they are going to be asked about. And last but not least, motivation is important to enhance adult learning and provide an enjoyable learning experience. What is the role of a university professor? One of our roles is to design and deliver effective learning experiences, to prepare a competent, safe primary healthcare provider, and to assess these competencies and if they are actually acquired or not. These learning experiences should enable students to acquire a knowledge core, related clinical communication skills, examination skills, and procedural skills, together with a professional attitude essential to perform the tasks expected from the primary healthcare provider. A list of common medical problems, situations, and procedures, and their related competencies has been prepared by a group of nominated subject experts, and this was based on the Dundee Core Clinical Problems and the Manchester list of index clinical situations taken as a basic benchmark. Now, considering the knowledge core should build upon the previous knowledge the students already have. Please remember that these students have already studied anatomy, physiology, pathology, and pharmacology in an integrated, connected form. And they studied virtual cases trying to apply this knowledge. So make use of this. The provided knowledge core should clarify connections and relations across different disciplines and definitely avoid repetition. While delivering the knowledge core, please consider that students are active learners and not merely passive receivers. Students already are trained to prepare for a session and they know how to work in small groups. Finally, make the maximum benefit from the face-to-face session. The face-to-face time is very valuable. Use it to explain, to answer questions, to discuss, to assess students, rather than merely using it in a traditional one-way lecture. Next, we are going to talk about the clinical and procedural skills. For clinical and procedural skills, it is important to define exactly the expected level of performance, because this will reflect on designing the learning experience and how the students will be assessed. Miller classified the performance level outcomes into 4 levels, starting with know about, where it is important to clarify the essential knowledge behind the skill. This is followed by know-how, where students can describe how the skill is performed. This is followed by show-how, where students can perform the skill in a controlled, simulated settings. And this ends with does, where students can perform the skill fluently. Be ready to give examples of different skills from your specialty and how would defining the performance level will affect the teaching and the assessment. Different models were proposed by educational experts and will be discussed in the face-to-face session. Please remember that these models may not be applicable to every clinical skills and can be combined to describe the skill performance outcome. For students to develop a clinical skill, they need, number one, a clear demonstration with explanation of the knowledge behind, of course. They need effective coaching with active observation and feedback. They need repeated practice opportunities and sequential exposure to more challenging experiences. We'll discuss this in more details. And it's very important to define the performance outcome. They need to know what is exactly expected from them. Finally, motivation for self-directed, proactive learning. Let's give an example. For students to develop a clinical skill, they need sequential exposure to more challenging experiences. How would you apply this principle if you need to develop the skill of history taking and complaint analysis? We will discuss this in the face-to-face session, and I'm expecting you to give us your ideas and about how to develop this skill in a sequential manner. The design of the clinical learning chain is shown in this slide. The learning chain will be explained and discussed in the face-to-face session. This is actually the core of the day one training. Thank you for watching this video, and we'll meet you in day one training. Until then.